Hi, welcome back to What Did You Learn? I'm your host, Ahava, and I'm very excited to have here today my good friend and colleague, David Tytell, who is the Director of Communications at MIT Medical. David, thank you so much for being here.
It's great to be here.
So I was very lucky. I have a son who's interested in going to MIT. He was 11 at the time, so that tells you about what he's interested in. And David showed me around MIT. It was so kind of him, and my son was like blown away. But you are in a pretty different situation, I think, at MIT Medical than some of our other healthcare communicators and marketers who are watching this show. So can you describe a little bit about how MIT Medical might be a little bit different than your classic healthcare setting, like a hospital or a center?
Yeah, so we're an ambulatory care center, and we're a closed practice. So we really just deal with the MIT community, students, faculty, staff, and their respective families. And that's it. So no one else can come. So it's this small community. And what that usually means is we're the campus doctor's office, for lack of a better term. That took on a very different meaning during COVID. And one of the things we've always done is we've always done public health. And, honestly, that's been like triple E, make sure you wear long sweatshirts when you're working out in the fields, God forbid a norovirus issue in one of the dorms, and, general student health. But this became very, very different. We were suddenly public health for the entire community. So that included people living on campus, essential workers coming to campus. And we took on the role of being in charge of testing and being in charge of contact tracing and ultimately being in charge of vaccinations as well, keeping this community as healthy as possible during a very scary, dangerous time.
Yeah. So, a lot of people had to rethink how they communicated, particularly the language that they used. But at MIT, my assumption would be that your assumption would be that you could use a higher level of language or maybe not be as afraid of jargon. Did you? And I wonder if that assumption is even true. I would love to hear how you would react to that.
It's mostly true, but it's interesting. So we cater to the entire MIT community, which means we need to send a single message that's going to resonate with our housekeepers and our Nobel laureates.
Right.
So the language has to be clear, it has to be crisp, it has to be engaging, but you can't bog it down with jargon or you're going to lose one part of your audience. But you also have to explain the data. You can't just say something's true. You've got to cite the studies. You've got to give the numbers. You've got to show the error bars. I used to joke before this that I couldn't just tell people to get flu shots. I had to explain the efficacy of the shot. That's still true with COVID vaccines. So it's the same playbook, but that's sort of the difference, is that you kind of have to, be all things to all people, because we do serve that broad community, but the wings of that community are really different than your traditional audience. mRNA vaccine, the early technology was developed here. The Nobel Prize for mRNA was developed here. By our scientists. So the story of mRNA vaccines is told a little differently to the MIT community than it is to the general public, but it still has to resonate with everybody. And you still have to deal with anybody who's concerned about it or doesn't understand the technology or is questioning why it would be safe. So the same issues that everyone has, we just have to sort of address them in a different flavor.
Sure. So let's focus on the communications aspect a little bit more, because I really want to get into how you've changed as a healthcare communicator and marketer in the last, and I know that marketing isn't exactly what marketing is for everybody else, maybe,
sure.
But is there a different David than the David that exists now?
Yeah, I think to a point. It's not as fun, that's for sure. Usually when you're on a college campus, you can have a lot of fun with your healthcare comms, and you can do experimental guerrilla stuff on the regular. And this has been like playbook, make it work, do what works. There's
no deviation, right?
Yeah, we experiment all the time. This is not the time for experimentation. So that said, I think that what's changed is let me just put it this way. I had an old boss who said, look, we work in healthcare. Unless it's life or death, it's never life or death. Which is a mantra I've kind of held my whole life since I heard it from her about everything in my life. Well, you know what? This is one of the few times as healthcare communicators where it really is life or death. So because the stakes are so high, I think that everybody's in it to win it. And at least my team for sure, and colleagues that I know are producing their best work. It really has been tremendous what we've been able to accomplish. And I think it's really, I guess the different David is that I've learned really how to laser focus on priorities and how to be as incredibly efficient as I can be, because there is no margin for error. And that little piece in the back of your head that says, oh, if this stumbles, it's okay. And frankly, when you experiment, stumbling is totally fine. And that's not so much. So you got to get it right.
Do you feel like you have an extra layer of having to get it right because the people looking at your content really understand the science and are the people in some cases who created it?
I mean, that's always true from a factual standpoint. The added pressure here is that, you're really, the communications we're doing right now as healthcare comms, it's the most important work we're going to do in our careers. I truly believe that. I've said to several colleagues and friends that this is probably the most meaningful work I will ever do in my entire career. And that's not a negative statement. That's realizing the moment and appreciating it for what it is. And I think that that's kind of the way I look at it. I don't feel like there's no added pressure in the sense of, like, obviously, if we screw this up and the MIT community gets super sick because we're not communicating properly, there are ramifications for that. We're never going to let that happen. So that's not really a fear. The pressure is the moment, not necessarily the employer, if that makes sense.
Yeah, no, it does. I mean, I want to actually go into what you're saying, because I think it's fascinating. It's something that I'm struggling with right now, which is that everybody learned, this is called What Did You Learn, right? And everybody's learned a lot, but everybody I've interviewed has really been able to focus in on, one thing that they really feel like they've learned and that they've put in their toolbox. When you say this is the most important work I'm going to do in my career, that's fantastic. And it sounds like you've done an incredible job at it. What I want to know, though, from all of us, but I've got you on the hook now, is that most important work that we did, how do we springboard into a place where we are braver with our efforts and we realize how important we are and we try different things?
Well, so fortunately, that's what we always do, because we're in a science school that's all about trying stuff and breaking it and seeing what works. So it's more the same.
Fail fast.
Fail fast, yeah. Learn from your mistakes.
Right. Make
better choices next time, and make educated errors. Like, oh, that didn't work. Didn't see that coming. Okay.
You're lucky that you have the permission to do that.
We do. We are. The fact that I'm in a culture that allows for that. I mean, obviously, I have to be a good steward of resources. I can't blow, 6 figures on a frivolous experiment. But on the other hand, like, it is okay to play and it is okay to try things. So I think what's different is that MIT Medical as an entity on campus was really seen as a doctor's office first, and not necessarily a health organization. And because, I used to tell people that, I sell the insurance to students and I do internal comms and I promote the clinic. And then the fourth piece of what we do is we do a little bit of like crisis communication whenever something happens. Well, for the past year, it's been 90% the crisis communication. And I think there's a lot of takeaways from that, where we're going to be able to really leverage the gravitas and clout that MIT Medical has to really affect change in the wellness and well-being of the campus. Best practices for work-life balance, best practices for sleep, athletics and exercise, beyond just clinical care. And I think people thought of us as clinical care in the place I get my flu shot every year. We have proven ourselves to be so much more, that we have a seat at the table, if you will, from the higher ed politics standpoint, where we're going to really be able to make health and wellness part of the DNA, to be punny, of the Institute in a way that it never was before.
When you're thinking about like editorial planning or the thing, like you talked about sleep and health and wellness and all that stuff, when you think about the things that you really want to tackle and talk about, what in your idea is really something that communications can bite down on really hard and affect change with? Because I know I have a high school student, like I said, who's almost in college. I could talk to her about sleep from here until the time she graduates from college. I'm not sure she's going to listen. She's not going to MIT either, but where are you thinking in your head? Are you going to focus on mental health? Are you going to focus on PTSD? Are you going to focus on physical wellness? Are you going to focus on germ control? Like, where are you in your mind? Are you going in the future?
Yes is the answer to your question.
All the things, Ahava.
All the things.
All of the things.
We're going to do them all. I mean, I really think the answer to your question is very audience dependent, of course. I think let's focus on students. I have several audiences I'm obviously dealing with here, but let's talk about students, for example. I think mortality is a real thing for students in a way that it wasn't before. And I think mental health is on the radar more than it was before. And the MIT students, there's a certain gravitas that comes and machismo that comes from, I didn't sleep at all and I worked 96 hours on this problem set. And that we're not going to get rid of that. But I think we can sort of tackle it and help to really get some headway against that problem. Because I think people are realizing that, I'm not going to go to class sick. I mean, how amazing would it be if the only thing we were able to accomplish through all this is that nobody goes to work sick anymore? I mean, that would move the needle so much.
So much.
So, I think we need to find what are those things in our respective audiences that we want to push on hard. Maybe it's mental health. Maybe it's work-life balance. Maybe it's just something as simple as, if you don't feel well, there is no longer a stigma that you are lazy because you didn't go to work. And
right, you can zoom in from anywhere.
Right, and you can zoom in from anywhere if you need to, and you just aren't going to get others sick when you're contagious. Wash your hands before you eat, people. Like, little things. I think there's a lot of headway we can make. And those little small things could have huge, huge downstream implications for the better. It's like getting students from 18 to 22 to get a flu shot every year teaches the habit that that's something they should be doing in perpetuity, and it really works. So, I think that's where we can all focus. If we can find each of us can find those lanes where we think we can have the most impact, and then really push hard and leverage it, because I think the receptivity of the messages is higher than it will ever be. I used to joke about, a bunch of us used to joke that wellness is something that's incredibly difficult to communicate because it's something that nobody actually wants. It's like dieting, right? It's like, oh yeah, I'm gonna diet, but are they actually gonna diet when that brownie Sunday shows up? That's human nature. Everybody says they want wellness, but are they actually going to do it? No. I mean, but now I think it's different. I think people see the implications and the consequences in a way that they've never seen it before. And, I hate to be Pollyanna and silver lining COVID, but I think there's some real opportunities for a healthier humanity going forward. And this is our opportunity.
How did you handle all the social justice things that happened? So they broke over the summer. You didn't have the kids on campus or the students, because I know you have a lot of graduate school students. What was your reaction? How did you think about how to communicate about it? I would assume MIT came out pretty strongly on one side of the issue, the right
yes,
side.
Of course. So this is me giving kudos to my team, which is tremendous. And my partner in crime, Kim Shive, wrote an incredible blog post very shortly thereafter, which was very practical. How do you protest safely during a pandemic? It was, in a sense, it's almost like a Clean Needles article. It's like, okay, you're going to protest, and we're not telling you shouldn't, But we're telling you, this is what you got to do because it is scary out there. And it's not scary out there just because of the social justice issues. It's scary out there because there's disease. So this is what you need to know to have your voice be heard without endangering yourself or others. And that spread like wildfire across the student population. Students felt—
because you hit on it. See, that's what's so brilliant about great content. You hit on what they wanted and needed to know in the right moment.
Exactly. So that's how we tackled it. You know, it's the vice president of communications for the Institute and the president of the Institute. They're talking about what MIT's feelings are about these issues. But as a healthcare organization, there's only so much we can do. We certainly can put out statements for our employees to say where we stand so they know they feel supported. But to deal with our patients, MIT is very practical. Give me what I can use. And that's not exclusive to us. And that's what we did. We said, okay, here's what you need to know. Here's what you need to do. Be safe.
Okay, but that's the health side. But then on the mental health side, which you're still responsible for,
Sure.
Is there perceived racism at MIT? Is there natural segregation based on, different populations?
It's like any population.
Any school,
there's implicit biases here, but there's always work to be done. And we can always be better. And I think it's on all of us to do our part. And from a mental health perspective, MIT Medical is here as a support network, whether you need to talk to somebody about race-based stress or about a specific incident or just about the enormity of everything happening. Students have a place they can go and people they can talk to. There is mental health available to every student. It comes with tuition. They pay nothing.
So David, last question. What did you learn? What was the most important tool you're putting in your toolbox now?
What I've taken away from this is that the job of science communicators, and honestly, I think all of us in healthcare comms are science communicators. The job of science communicators is a lot harder than I thought it was, and I've been doing this for over 20 years. And I didn't appreciate just how challenging this job is because I didn't appreciate that there was an entire audience out there that I was blind to, that I got to try to reach. I'm not sure how. I'm trying to figure that out, but it's kind of scary. That said, I'm not going to lie, being in a little scientific bubble of MIT, it does make my life a little easier. So
some of the best leaders that I've interviewed are like you in the sense that they say, I'm going to lean into the discomfort of this moment. I'm going to know that I'm not doing something right, or not that I'm not doing something right, but that I have to start listening. I have to start changing the way that I see this. Everything that I've done that's gotten me here isn't going to get me to the next place. And as a community of marketers and communicators and health communicators, I think that's what it is. Like what worked might not be working anymore, if it ever worked.
Totally agree. Totally agree.
Anyway, David, where can people find you if they have further questions?
So our website is medical.mit.edu. We have our COVID-19 blog, which is tremendous work. I'm so proud of our team, where we tackle all the tough questions. And you can reach us through the website. And all those questions go to me and my team, and you'll be able to track us down, no problem.
Great. Thank you so much. Thank you for being here. It was wonderful to have you.
Absolutely. My pleasure.